Hello and welcome to the Principles of Substance Use Prevention and Health Equity in Action training. This is one of 3 videos and is going to focus on harm reduction. So our learning objectives for today are 1, to increase awareness, have a brief history of substance use in America, some harm reduction frameworks, as well as providing information and where to find resources. So before we start, just kind of a note about person first language. A lot of people hear in the media or just everyday conversation some potentially stigmatizing language, such as calling people addicts or junkies, users, drug dealer, substance abuse, clean, replacement or substitution therapy. And the language that we're going to try to use today, we encourage you to use, especially if you're not in the community of people who uses drugs, is some of this more compassionate language, like person who uses drugs, person who sells drugs, substance use or misuse, and then person changing their drug use or abstaining from substance use, or medication for addiction treatment, or MAT. Note that people who use drugs may refer to themselves as an addict or user, etc. And we want to allow people to identify themselves and not correcting that language. But if you are someone who is not in the population of people who uses drugs, we would encourage you to use this person first language. So just kind of starting with the history here, what is legal and illegal has been fluid in America. There's a lot of different drugs that were legal and even sold as pharmaceuticals that are now illegal today. So first off, heroin was marketed by Bayer to suppress coughs, numb pain, childbirth, war injuries, even from some mental health concerns, as well as powder that contained opium, which was originally made for coughs and colds. Obviously, both of these things are not legal anymore, but they were originally made for pharmaceutical purposes and sold that way. So kind of looking more to the modern day, Oxycontin, which is often called Oxy or oxycodone, was approved in 95 by the FDA and has since been taken off the market to be reformulated. So it was kind of not legal for a while, and then it was put back on the market and it was legal and once it was reformulated and had some other warnings on it. So it's a good example of something that has been legal and then illegal again and then legal again. Fentanyl is used to treat pain. That's sold in the form of patches by Janssen, which is also known as Johnson & Johnson. So fentanyl does actually have a pharmaceutical use. And then same with methamphetamine. That's sold to treat ADHD in youth. In pretty low doses, but I think a lot of people, think meth doesn't have any purpose, and it actually is sold as a pharmaceutical. So there's a lot of substance use inequities historically in the United States and today. So I'm just going to go through kind of a brief overview of them. So first off, in the 1870s, anti-opium laws were directed at Chinese immigrants. In the early 1900s, anti-cocaine laws were directed at Black men in the South. The difference between crack cocaine and powder cocaine really is just one inactive ingredient. And so it's interesting to see the different regulations for crack cocaine versus powder cocaine, simply because crack cocaine was associated with Black men and powder cocaine was associated with white men. Anti-marijuana laws in the Midwest and Southwest were directed at Mexican migrant workers. And in Colorado and other states where marijuana has been legalized, people of color are still disproportionately arrested and convicted for marijuana charges. And it's important to note that people in different races all use substances at similar rates. So this has nothing to do with use rates and more to do with the racism that's going on there. So just to give a brief definition of harm reduction, it refers to policies, programs, and practices that aim to reduce the adverse health, social, and economic consequences of the use of legal and illegal psychoactive drugs, without necessarily reducing drug consumption. This benefits the community, people who use drugs, as well as their families and friends. For those who don't know, psychoactive drugs is referring to anything that alters or changes the state of someone's mind. So some everyday examples of harm reduction. One is condoms. We kind of know that abstinence-only education does not work, and telling people to just not have sex doesn't work, right? But we can provide condoms to prevent unwanted pregnancy and prevent STIs. So that's a really good example of harm reduction. Another one is seatbelts. We know we're not going to have people stop driving cars, especially in America. It's a pretty important thing in our daily lives. But we can at least provide seatbelts, airbags, make sure that people know how to use those, and make sure that there's a standard there, and that can reduce the harm of getting in a car accident. Kind of same thing goes with biking or climbing or skiing or any other activity that you might do, that you might wear a helmet. we know that those physical activities are actually really healthy for people, right? And we want them to do those physical activities, to make sure that they're getting that exercise. But it can pose some dangers, right? So, you can, if you fall on a bike or something like that, you might hit your head. So we can have our helmets that'll protect from concussion. Um, and that's just a good example of where, harm reduction can also be used in situations where the activity is actually overall a healthy thing. And lastly, kind of getting back to the substance use part, we know that people can use nicotine patches, so put something on their body instead of smoking a cigarette, and that can help with withdrawals, and prevent from someone smoking getting all those chemicals in their lungs. So some of these harm reduction principles that we've sort of narrowed down into this pretty small 4 different categories. These are just the essential parts of harm reduction and things that are important to remember. So first of all is that it's individually centered. We want to make sure that in any harm reduction program we are treating people as individual humans with different experiences, and they're bringing their own lives to us, and yeah, everyone is different. There's not going to be one specific strategy that works for everyone. Another one is that we want people to remember that they are their own autonomous human beings and their involvement is essential. People get to make their own decisions. People get to decide what is best for them, and their involvement is really crucial. Harm reduction programs are not built on trying to force something on someone. It really is trying to make sure that the participant is really, really involved in the process. Next is recognizing inequities and trauma. Trauma and inequities can really change how people use substances, why they're using substances, how easy it is to stop using a substance. And so it's really important to consider those things when we're talking about how people can change their use, or how they want to move forward. And lastly, we want their decisions to be practical and realistic. Something might be practical, like say decreasing use for one person, and they think that that's a reasonable goal at that moment. And for other people, that might not be practical, right? So for other people, it might be practical to say, "Hey, I just want to stop injecting. I'd like to start smoking drugs instead," because they know that that reduces the risk of overdose. Other people might just want to come in and get clean syringes to make sure that they're using sterile equipment, stuff like that. So anyone can, try to reduce the risks of their use while not necessarily having to reduce the substance use itself, if that's not practical at that point. So, we talk a lot about harm reduction and in contrast with the abstinence, but it's not really mutually exclusive. Abstinence is kind of this single option, and is prescribed. We're trying to stop people from using altogether. It might be really difficult to achieve for some people. And because it's not necessarily focused on that, individualism, it might feel more coercive or judgmental. Um, on the other hand, harm reduction is offering this broad range of options, including people can stop using if that's what they would like. It's considering those individual circumstances, so trying to work out what might be the most convenient for someone, or the most practical for someone. Focusing on what's achievable, and then feels, somewhat, there's a little less judgment there because people can go at their own pace. If they decide to, go the abstinence route later, that's great if that's what they want. But if they're just not there yet, that's totally okay. They might never be there, and that's okay. So just kind of looking at the spectrum of substance use to, talk a little bit more about stigma here. I'm going to just outline this diagram first because we're going to go through it in a couple slides here. So all the way on the left, you have no use in that blue range. In the middle, there's like experimental, social, recreational use, more regular or daily binging towards that, like getting towards the orange range. And then towards the like darker orange and red range is the substance use disorder section, which would be mild, moderate, and severe. Some people choose not to use those terms. That's what this chart has. So we're going to go with that. So you have to remember that anyone who's using any substance could be at risk of overdose deaths, HIV, Hep C, soft tissue infections, negative consequences of using a substance, right? So anyone who's using any substance has a risk of those negative consequences. But what's interesting is that we really only associate the stigma and discrimination and marginalization with people who have substance use disorders, or who are, at least towards that orange range of this chart. And we don't really think of people, using any drug and not having a substance use disorder, at being risk for like overdose or other infections, stuff like that. But that really is true, that all of those risks exist along the spectrum of substance use, but we really only stigmatize people who are using more consistently to the point where it is a disorder. So that's just something to think about. So where does harm reduction sort of fit into this whole thing? So harm reduction is kind of going from anyone who's ever used a drug. So are you using drugs all the way up until like substance use disorder, like more in the severe section. So basically everyone but the no use category. And then prevention starts with no use all the way until like, let's say that recreational range, regular range, and it's trying to prevent people from going further along that line toward that red section. So prevention is trying to, obviously prevent initiation of substances, but also prevent people from increasing that use or making, riskier choices. Whereas harm reduction is trying to, you know, work with people who are already using a substance and, make that less risky for them. So what can harm reduction look like? One example, and this is just one example, it certainly does not encompass everything, but is the WORKS program. So Boulder County Public Health runs a harm reduction or syringe exchange program. It's the third oldest in the country, and they provide education, harm reduction supplies, HIV and Hep C testing, street outreach, referrals to services, as well as case management now for people who use drugs. So it's one option to participate in harm reduction programs if people who use drugs want that point of contact as a great free resource. So there's some other resources here too. So the Harm Reduction Action Center in Denver is another harm reduction service, or it is a syringe exchange as well. That's their number. You can also look them up online. There's the Never Use Alone hotline. So that's a hotline that you can call to make sure that you're not using alone. There will be someone on the other end of the line, kind of helping through the process if there's something that happens, whether you overdose or have another negative consequence of using. They can call 911. And then the Brave app, which is an app on your phone, and that allows you to request help in the case of an overdose or a negative effect. So it's kind of an app where you have to check in after you take a substance to make sure that you're okay. And they can call 911 or an emergency contact or whatever you decide your preferences are in the app. So it's a great option for people who are not able to physically be there with someone. So those are all examples of harm reduction.
And lastly, just some examples of questions to think about. So what are some examples of harm reduction you've participated in? And where could you apply harm reduction principles to your work? We really appreciate you watching our videos, so thank you. And if you want to join our team for the Substance Use Prevention 202 live workshop and group discussion, please feel free to reach out to Audrey at ASCHROER@bouldercounty.org. Thanks.